final session today, we have a fireside chat moderated by my colleague, Dr. Uma Aisova, who is our Global Director for Communications and Partner Engagement at Access Health International. She has over 35 years of experience in hospital management, strategic planning, and CSR. And she also served as the chairwoman of the Confederation of Indian Industries Indian Women Network, Telangana, in 2022 to 2023, together with Dr. Yelena, Chief Strategist and Acting Chief of Primary Healthcare at the Center for Indonesia's Strategic Development Initiatives, Dr. Mustaq Chowdhury, Advisor at the James P. Grant School of Public Health at Bragg University, as well as Dr. Rajiv Sen, Senior Advisor at NITI Aayog. May I invite Dr. Yelena, Dr. Rajiv, and Dr. Uma on stage, please.
Thank you, Tim. May I have my... can you check if Dr. Professor Mustaq is online? Good evening, Dada. I am so missing you in person today, but I can't hear you. Can you speak a little louder?
Oh, can you hear me now?
Yes. Thank you. And before I go and sit down, I just thought I'd stand up for a bit. Any of you that want to stand up for a bit before you sit down, because you've had a long day sitting down, I would appreciate that. It's not easy to be the last person to speak. It's easier to be the first person to speak like I did this morning. So, do I need to wake everybody up? Do we need to shout and say hooray? No? Okay. So I'm going to just touch on a few points before I sit down and start the questions. We talked about unpacking purpose, policy, people, planet. 4 P's that have gone into marketing, gone into all kinds of things. But when you want to bring it to a public health conversation, especially into community engagement, and at the end of the day, with long 4 or 5 sessions that we've had, you must realize that all we talked about was to touch the lives of these people who are going to benefit from all the strategies that we have heard during the day. So the tool is about people, and so is the digital health about people too. Without them, who are we? And I'm honored to be speaking to people who have the unique distinction of having worked very closely at the bottom of the pyramid with people in 3 different nations. I have Sri Rajiv Sen, who works with 1.4 billion people, and anything he changes the lives of many. I have Professor Mustaq, who started the movement in Bangladesh with the healthcare with BRAC and then later with Bangladesh Health Watch. And I have Yelena, who works tirelessly in Indonesia to talk about healthcare initiatives that will actually affect the lives of people right there. So before I dive into the heart of the community engagement and the purpose and policy that these stalwarts have shared, I may just want to share a few lines about Professor Mustaq and Yelena, who have not been introduced this afternoon. Professor Chowdhury is a distinguished development worker, researcher, academician, and holds the advisor James P. School, Grant of Public Health, Bragg University. With nearly 4 decades at Bragg, the world's largest NGO, he he served as the Vice Chair and Executive Director and Founding Director of the Research and Evaluation Division. Professor Chowdhury's extensive contribution to global health have earned him several awards, including the most prestigious of them being the Medical Award for Excellence. Published 200 peer-reviewed scientific journals. I could go on. And the most recent, of course, was a book that he brought out where there were 50 years of Bangladesh and healthcare that was captured in it. I'm also going to talk about Yurdina, Chief Strategist and Acting Chief of Primary Healthcare Center for Indonesia's Strategic Development Initiatives, SISDI, and the journey that she has taken into critical public health care policies in Indonesia. She's a physician with a master's health degree from the University of London and works to enhance health policy implementation in Indonesia. Since 2021, she has led a program engaging 1,004 community workers, employing a web-based application for decision-making support. My privilege to have all three of you to talk to me today about community engagement. Since we do have, just about 20-25 minutes, I would request Professor Mushtaq Chowdhury to go first and give us all his views on the questions that I'm posing so that we do not have to go back and forth with him on a dialogue. And I start with you, Dada. What was the purpose that shaped BRAC and the Bangladesh Health Watch? What kept the spirit going? And what still guides the last mile change that you allow for to make policy and change the way government views healthcare? Of course, climate has become an important part. How do you want to deal with it? Thank you.
Thank you, Ma. I have a bad cough actually. I'm so sorry that I cannot be with you in person. I was supposed to be there, but for some reason I had to stay back at home. But I'm with you in spirit, and I really miss this event very much. I was looking forward to. I have been involved with HSR almost since the beginning, and we are a proud kind of country to be formally declared as part of the HSR movement, and we are really grateful to Uma and of course Professor Krishna Reddy and all others for this opportunity, and we look forward to continue working with you on the resilience issue, which has become more and more important since the pandemic. As Uma was saying that I have been recently promoting one of my work, which is a book on the 50 years, the initial 50 years of Bangladesh, and how Bangladesh has done over the years in health. And we have been trying to document all these sort of important changes that has happened in the country in terms of under-5 mortality, or the total fertility rate, or the life expectancy. And just to give you an example, the life expectancy at birth, when Bangladesh became independent in 1971, it was in the mid-40s, but now it has gone up to 74, and which is a kind of a big sort of improvement. But more important in this trajectory of improvements is the gender difference. And until about 2 decades ago, Bangladesh was one of the few countries in the world where women lived a shorter life. but now this has been corrected and women now live about 3 years more than men. So this shows how the country has prospered over the years, and the role of women in this is very, very critical. So we have been trying to see what has really triggered those changes that has happened. One of the issues that we have also encountered and tried to document is that it's not only positive things that has happened. There is a paradox there. So Bangladesh has achieved all these despite many of the challenges, including the challenge of governance, including the challenge of low investment in healthcare by the government. So despite all these, Bangladesh has made good progress. And in this book, we have been trying to find out what are the reasons behind this. And one of the reasons that we have identified, which was also sort of mentioned quite elaborately in the Bangladesh series that the Lancet published several years ago, was the role of this civil society, the community at large, and some of these are represented by the NGOs. The NGO movement in Bangladesh started quite long ago, even before the birth of Bangladesh. But it got real momentum after the establishment of the state of Bangladesh. And BRAC and several other NGOs are the product of the liberation war that happened in 1971. One of the reasons why BRAC and others were set up were really to help the poorest of the poor and other sort of vulnerable groups to get out of poverty, and that's what the NGOs have been doing. And I'm so happy that has really resulted in some of the spectacular changes that has happened. Some of the reasons why Bangladesh has done well is the implementation of several public health interventions, which included things like family planning, immunization, and oral rehydration. And all of these were mostly implemented by the NGOs with support from the government, of course. So NGOs have actually played a very important role in Bangladesh development. But as we go forward, it seems that there are many challenges that the NGOs are facing these days. The space that was created by the government itself is now actually shrinking. The freedom that the NGOs enjoyed in the past is kind of changing, and we have seen that during the pandemic, where the NGOs had very little to contribute to, unfortunately. And the other reason for why the NGOs' work is becoming less and less important is that the funding for the NGOs, which came mostly from the European and American government and other institutions, that also are sort of shrinking because of the Ukraine war, because of the Brexit, and because of the pandemic. So these changes are really putting the NGOs and the civil society sort of contribution in very much challenging situation. There are many ways that the NGOs have contributed. They implement programs. They also sort of do social mobilization, and also they are the opinion leaders And one of the things that we have been doing over the last several years is what Uma mentioned about, is the Bangladesh Health Watch, which is a civil society initiative, and it was started in 2006, and every year we publish a state of the health report in which we talk about specific issues in health, which is a kind of a parallel report that we publish in parallel to the government. This has actually played quite an important role in creating opinion about specific issues. Although it's not that everything that the Health Watch reports say is sort of accepted by the government also challenges those reports as well. But we feel that at least the government, we are able to engage the government in such debates, for example. So that itself is a major accomplishment, I think, and we continue to sort of do what we feel as civil society initiative to do, and we'll be continue to doing that in the future. I'll stop here.
Thank you so much, Dada. And I know that to limit your time for a conversation that can be a whole day's conversation is really tough. But I'm so glad that you did come online and that you did share some of the challenges that civil society organizations are facing. And some of those thoughts are very relevant. And I think when we talk about community engagement, is it about the people? Is it about individuals? Is it about groups that come together? What is the stature of these people? Who comes together? Are they gateways? And each country or region, the people are the same. The communities are the same. The thought process and the attitudes are the same. But there is a difference. And I'm going to talk to Yudirna and ask her what her experience has been, because they brought out a policy. They have been through a whole journey and they have faced a lot of challenges. But they also have been through COVID, and they have actually motivated a lot of the people at the last mile to be able to stay there and provide all the necessary wherewithal for the community. Two ends of a spectrum. Yudirna, your thoughts?
Yeah, it's a long questions. Probably compared to Brak, Chisti can be considered new, but our journey are different. As in, we started as an organization that was within the government. So Chisti was the office for of presidential envoy on MTD. So we started at the first time as a government. And the first program that we had, which is sending multi-professional team to the rural areas of Indonesia, was actually invented during our time as a government. So I think Chisti experienced a big shift in which we need to deliver a program, we need to do hand-holding for Puskesmas, the primary healthcare in Indonesia, from a government entity to a CSO, and that's different because even though I think the recipe for community engagement, the recipe for hand-holding and intervention is the same, but it's different when you're a government and a CSO. And I think the challenges are some of the challenges already mentioned. I think navigating your work on the field within a complex environment where the policy changes, and there are a lot of initiatives we heard before from the DTO, for example. There's a lot of new innovative approach that the government is doing, but on the field you remember that the community needs to basically handle a different kind of things. They're still having the old institutions, so to speak, but also need to adapt to the new innovative approach that the government is trying to pilot and also change. So I think the engagement with multiple layers of community is important, and also maintaining the flow of learning, the flow of we learned this morning about, for example, a different jurisdiction within communities that also changing with the changes in policy. And I think maintaining that level of understanding all the time and trying to navigate and adapt, it's the key to sustain whatever work we do with the community.
Then you outlined that very well. But what brought out from your conversation was the trust that is required for people to be engaged at the bottom of the community. And nothing, once they trust you, they will walk to the end and fall into a well if you ask them to. But for that trust to be gained, and over a period of time. I'm coming to the policymakers' lens when I speak to Rajiv Dada, and I'm going to ask him. We've had Ayushman Bharat that came in, a PMGY that was initiated, and a digital Ayushman Bharat digital that came across, and several initiatives that have encompassed health versus many of the initiatives that have always been a part of the government. Your passion for health literacy, schools, engagement, and what the government is trying to do, are they hand in hand, or is there anything else that you would like to share that we can take forward as Access Health to be able to support that?
Okay. I think what I'll say is not only for health, but as a delivery system from government as a whole. Now, all of you must be knowing this idea of this, not the idea, the concept of Jan Bhagidari. Now, any program, it is not that schemes were not there earlier. Schemes have been there throughout. But what used to happen is, schemes would reach to some people, others would not be, the beneficiaries of those schemes. And what happens then? People start thinking, because these people are politically aligned or whatever, they are able to get the advantages. We are not, never able to. So I think this very concept, of taking people along, community involvement is nothing but taking everyone along. How does this come in? So again, here I come back to what I said in the morning, the programs of these aspirational districts and aspirational blocks which have been started recently. So what were these programs? The two cornerstones were saturation and convergence. Schemes existed. Before Ayushman Bharat, before PMJY, there were schemes. But they had to be brought and it had to reach the people who it is intended to, all the people. So there was an effort that, and that effort is still going on through this Ayushman Bharat initiative which has just happened, to ensure that an area or the identified districts or blocks are saturated with all the benefits. Everyone in that village, district, whatever may be the unit, gets the advantage of that scheme. And convergence, because as you know, there are myriads of schemes all across ministries. You have the self-help group scheme, which is being run by rural development. You have health schemes run by health, women and child welfare. So how to get all these schemes and converge them and saturate. So that I think has been very instrumental in bringing the community together. Once you know that yes, these benefits of these schemes are also for us, there is a sense of belonging. And then people tend to cooperate and they themselves tend to bring out how those could be. I'll just give you an example. I had visited, there's a district in Tripura called Thalai, which is one of the aspirational districts. So there when I went, it's a very remote district. But there people were, the medical system, there were things lacking. I wouldn't say they were not, the schools were not that good. However, when I looked at the health side, within the community, they managed to get someone from another district who would visit them once for basic cardiac issues and others. And the more important thing was the use of mosquito nets. They didn't believe in those things. They thought, yes, sir. But once they saw, and there were people who were there from other communities who came and showed that, yes, if you use nets, they are very, very useful. So these small things, until and unless you generate that confidence or that belongingness among people, you will not be able to, drive it through. That is what has happened. All these schemes, even today, Ayushman Bharat cards, it's not that everyone is, using it or going to the hospital the next day. But the very fact that it's an entitlement. Today, if you have that card, you know that you have a 5 lakh cover, $500,000 in terms of cover. So that itself, and that it's happening. That the person next door has availed of that benefit. And so these things, I think, that is happening, and that Jan Bhagidari, where people start believing in government and government schemes, is happening, and that has helped in this community, community-led development process. Lot needs to be done, but I think the process has started.
When you are the last session for a day and you are given a certain specific time, it's very hard to take a deep thought into a lot of the questions that we already have. I would request my 3 esteemed panelists to give me one of their most important takeaways and also share what they would want to see the community engagement thematic area take forward as one of the major areas. So over to you, Dada. Professor Mushraq.
Thank you, Uma, and thanks to my panelists on this. I learned a lot from what you were doing, of course. But I think the role for the NGOs will continue to be there for the improvement of the health of particularly of the downtrodden, the poor people and women and others. The challenge is how the movement that we have started with the HSR can actually lead to what we have to achieve a resilient health system. And in order to really build that, the role of the community, the role of the civil society will be enormous. Without that, we cannot build a resilient health systems, whether it is in Bangladesh or India or Indonesia. So my proposition is that we continue to identify ways of how to engage the civil society more in making the health systems more resilient and ready for the future pandemics that might strike. Thank you.
Yeah. So I think for me, looking at Indonesia right now, the mechanisms, as you said, to engage community, it exists, formal mechanisms and all sort. But I think the biggest job that we yet to do is being able to first validate what the community needs. We come to community with our eyes, with our North Star, which is mostly basically what the government document is telling us what's the North Star are. But maybe but maybe community thinks differently. I went to the field last week and we told the doctor about the conference, making sure that each family has a complete 11 services that can prevent their children to be stunted. But then what they want is actually just the primary healthcare to open at night, because that's the only needs that they want, and that's not within the convergence list of actions that the government is offering. So maybe we should start back a bit and find a way to do some validation check about what the community needs.
Yes, baselines are always about the gap and the aspiration. So may I request you, sir?
Yeah, I think I have to go back to what I had said. I think the most important thing is trust. Once the general people have a trust that yes, there is a delivery mechanism which is working and it is working fairly and squarely for everyone, I think that's the basis of community, whatever, participation, development. Once people start believing that yes, what I am entitled for or what the schemes tell us that they will give is delivered, I think that itself will bring the confidence, and that helps the community to develop.
Thank you. I have 2 minutes left before I close, so I can take one question if there's any. And if there isn't, yeah, sure.
Generally the questions come from that side to this side, but due to paucity of time, I just wanted to ask one question to Mr. Patota. Yeah. So you said, is that okay if I? So you said that in the digital part when you were explaining that you are taking it to the community. So what exactly is the digital component or the components that you are taking to the community? If you could kindly elucidate on that.
Yeah, specifically what kind of digital component? We as the government, we built our own application as well for the cadres. That's one thing. And the second one, of course, we collaborate with different NGOs at the moment. Not only on the digital literacy, digital hygiene, as well as how they would like to be empowered. Because sometimes they don't need new application, they don't need new system. Like you said, they just need something simple, like can the healthcare facilities open at night? And for us, one of their main problems are, from the healthcare workers' perspective at least, they have 2400 systems. Can we simplify that? That's one of them. And as for the mothers, they would like to access the record of immunization for the babies. They would like to get their USG data directly on their phone after they check on the healthcare facility. So what we have been developing, of course, not 100% based on real situations on the field, and we need to do more validation, but yeah, mostly we give like the specific applications. I know we already have 400 applications and we adding one application to that, but we at the moment try to see as many solutions as possible, and the innovation is how many solutions that we can have, and then we simplify it. At the moment we are still in this phase of mapping the digital aspects that we have. Because at the moment we don't really know what digital aspect that should be implemented. Is the digital application for the cadre or mobile application is the right answer? We don't know. It's not a silver bullet for everything. So we try as many solutions as possible, and then we simplify it later. Hopefully that answers the questions. Thank you.
So with that, I'm going to say, okay, Shadi ma'am. I just wanted to make a comment and really thank Dr. Sen for bringing out, what India is doing, and just to supplement 2-3 points. One, I think what is really, India has had a very rich history of, engaging with communities and through NGOs and CSOs. But I think what is really making a huge difference in the last couple of years is governments, attempt to embrace diversity in the community. And I think that's really not just about poor people or people in informal settlement. It's now today about people with alternate sexualities or people living in really remote districts, like he talked about the aspirational districts, identifying where the real gap is. So I think this understanding communities' diversity and embracing that through all types of schemes, to my mind, is really something which is making a lot of difference. A second point, I think, is that we are today working at intersectionalities of these diversities. So it's a woman who's poor, who's also tribal, who probably also is a single mother. So these are the intersectionalities that we are understanding, and we are, I guess, trying to make sure that it's not just about certain types of people that we've already always worked with, but really looking at the social determinants of health or talk about anything. And I think reaching out to school children and sort of catching them young kind of an approach. So everything, all this is probably creating a different kind of community engagement. So just to supplement, but I think he's spoken a lot about whole of government approach also. So thank you so much.
Ma'am, we will definitely keep coming back to you for more on how we should shape the community engagement with your deep interest and also the expertise that you've had and have shared, how many lived experiences that you have been through. But I'm just going to sum it up with 3 C's. The collaboration, that's very important. The consultation, which Udarna brought about, without which we are not going to be able to progress. I think all 3 panelists brought out the fact that unless we are consultative in nature, we don't know whom they trust, we don't know what they want. We need to be able to bring out what they need rather than what we see as a need. And of course, communication. Unless we tell them what they would know or what they should know, and they embrace that, community behavior and behavioral change is a distant future. So to bring about all these things, our thematic area on community engagement is going to be consultative with all of you that are present here and those that are experts in the field to take this forward. Just to show how sustainable we are, please, when you go back home, tear up your tags, put them in water, soak them for a bit, and put them into land. You'll have flowers. The idea is GLC will grow flowers and let's share knowledge as we grow those flowers. And all of us are in it together. I'd like to say thank you to my panelists. Dana, I miss you. What a joy to have you on this panel with such short notice. Udarna, you're a friend. Can't be better. Thank you so much. I'll give it back to Tim.